Our viewer Maria tells me she has a family history of glaucoma. She's a little concerned about her own eyes and wondering at what point in life does she really need to start getting her eyes checked and have her doctor look for that every time.
Well, if you're a glaucoma suspect, Melissa, you certainly need at least one eye exam per year. Now, if the doctor finds that there are some reasons to believe that you may have some suspicious findings in terms of vision loss or whatnot, you certainly need to be seen more than that, at least twice a year.
Well, she has a good sense of humor because she was telling me, is there anything I can do besides get that little puff in my eye? She apparently doesn't like that very much. A lot of people might say that. Are there any other types of tests for it?
Well, actually, what that does is to test the pressure of the eye. But what we find is that many times, many patients that have glaucoma actually have low pressure. What that does is to test the pressure, and certainly in order to test the pressure, we use different technologies now. That's kind of a thing of the past.
Oh, so she doesn't have to do that. Oh, she'll be happy to see. Are there any new treatments for glaucoma? Is there hope for patients who have this?
Well, there's always hope. I mean, the conventional treatments are all aimed at lowering intraocular pressure, or the pressure inside the eye. So by lowering the pressure, we protect the health of the nerve fibers, or the wire that connects the eye to the brain, which is the one that gets damaged in glaucoma. Now, we're looking at different ways of treating glaucoma by protecting the actual optic nerve, and we do that with, well, there are different protocols that are being investigated. All of them aim at neuroprotection. We're seeing very amazing results now, and obviously she can call us to get more information.
I always hope that our viewers learn something from these segments. For anyone who doesn't understand glaucoma, do you know what causes it and what are some of the symptoms that they would want to look out for?
Yeah, I always remember a book when I was back in school. It was called The Glaucomas, and it was a thick, thick book. We don't really understand what is it. There's not one single cause for glaucoma. We could say that high intraocular pressure or high pressure inside the eye causes glaucoma. The question is, what causes the pressure being high in the first place, right? What I find personally is that the lymphatic drainage may be blocked in the upper torso when you have glaucoma. There are other theories, of course, where they say that there's chronic inflammation at the drainage system that drains the water out of the eye. There are other types of glaucoma related to anatomy, like you have a specific eye anatomy that can cause and can trigger glaucoma. So there are many, many different kinds of many types of glaucoma, but 90% of the glaucomas are all related to pressure being high in the eye.
Very helpful and very educational too. Thanks for your help today.
Thank you, Melissa. It's my pleasure.